Have you ever noticed pain or sores around your genitals, bottom, or groin, like small cuts that won't heal? Or maybe swelling in your legs or near your private parts that feels strange and uncomfortable? If yes, it might not just be a simple infection. One possible cause could be a disease called Lymphogranuloma Venereum, or LGV for short. It starts quietly, often without big warning signs, but if left ignored, it can lead to serious problems. Think of it like a sneaky thief. It enters without noise, but causes damage over time. Even worse, many people don't know they have it because symptoms can be mild at first. So, if you're sexually active or have new partners, knowing about LGV is important for staying healthy and avoiding long-term issues. So, what actually causes LGV? It is caused by a specific type of bacteria called Chlamydia trachomatis, but not the common kind that causes regular chlamydia. This one is a more aggressive cousin, types L1, L2, or L3. Imagine bacteria as different families of germs. Most chlamydia germs cause mild infections, but the LGV family likes to go deeper, into the lymph nodes, the small bean-shaped filters in your body that fight infection. How does it spread? Mainly through unprotected anal, vaginal, or oral sex, especially if there is a tiny cut or tear. For example, think about two guys having anal sex without a condom. If one has LGV, the bacteria can sneak into the other's body through small sores or even the natural moisture in the area. It is not spread by toilets, kissing, or sharing clothes, just close sexual contact. Now, what does LGV feel like? It hits in stages. Stage 1, a small, painless sore or pimple may pop up in the genital or anal area, maybe after a week or two of sex. But it heals fast, so you might think, oh, it's nothing. Stage 2 is worse. Weeks later, you might get painful, swollen lumps, called buboes, in your groin, imagine hard, tender grapes near your genitals. If it's anal, you may feel like you're constantly needing to poop, have blood in stool, or pain during bowel movements, like a bad case of hemorrhoids that won't go away. Some people even get fever or feel tired. For example, think of someone who has diarrhea and butt pain for weeks after a sexual encounter and keeps ignoring it. That could be LGV silently damaging the rectum. If untreated, Stage 3 can cause serious scars, blockages, or even tissue damage that needs surgery. How do doctors know it's LGV? It's tricky because it looks like other infections. But if you say, I've had unsafe sex, and now my butt hurts, the doctor may suspect LGV. They'll swab the sore or anus to test for chlamydia, and if positive, do a special test to check if it's the L type. Blood tests aren't used much, but imaging like ultrasound can check for swollen lymph nodes. The good news, it's treatable. The main medicine is doxycycline antibiotics, taken twice a day for 21 days. Think of it like a 3-week germ killer mission. You must finish all the pills, even if you feel better early. For pregnant women or allergic people, other meds like erythromycin are used. If pus-filled lumps form, a doctor might carefully drain them not with a knife, but with a needle, like letting air out of a balloon. After treatment, you'll need follow-up tests to be sure it's gone. How can you stop LGV before it starts? Think of your body like a house. You want strong locks on the doors. Using condoms or dental dams during sex is the best way. But remember, LGV can infect areas not covered by a condom, so it's not 100% protection, but still helps a lot. For example, if you're having anal sex with multiple partners, a condom is like a seatbelt. It reduces the danger. Get tested regularly, especially if you're in a high-risk group, like men who have sex with men or people with many partners. If you're diagnosed, tell your recent partners so they can get tested too. It's not about blame, it's about care. Also, avoid sex until treatment is complete. And no, showering after sex won't wash away bacteria. Only prevention and testing can do that. Recently, outbreaks have been seen in Europe and the US, mostly among gay and bisexual men, often linked to HIV or other STIs. Scientists are now using genetic tracking, like bacterial fingerprinting, to follow how LGV spreads between people. New fast tests are being developed to tell regular chlamydia apart from LGV quickly. Also, studies are looking at shorter antibiotic treatments. Can we cure it in less than 3 weeks? Trials are ongoing. One cool advanced mobile apps in some cities now let people report symptoms, get free test kits, and stay anonymous. This helps catch LGV early. Researchers also stress that talking openly about anal health and STIs reduces shame and gets more people tested.